Hi, my name is Dr. Robert Leahy, and I'd like to thank you for inviting me to address Dr. Rashid and the Pakistani Association for Cognitive Therapy, and I want to wish you the best of luck with your Congress. I'd like to speak with you today about some of the work that we've been doing on how to handle worry, and I'm sure that in Pakistan, as is true in the United States and throughout North America and Europe and throughout the world, that worry is an everyday problem. For example, in the United States, 38% of people worry every day. They say, I've been a worrier all my life. So people normalize worry as something that is a common problem that they have, but they don't feel a sense of urgency in doing anything about it. But the problem with chronic worry is that it eventually leads to depression, into a dysthymia that may last for years and years and years. We know that worry is a core feature of all of the anxiety disorders, and that it also is associated with gastroenterological problems. Women are twice as likely as men to have generalized anxiety disorder, which is the worry disease. Many anxiety disorders go untreated for many years, and in many cases, even when they get treatment, it's not adequate treatment. We also know that in the United States that the degree to which people are anxious has increased substantially in the last 50 years. Jean Twang's research, University of California, looking at a meta-analysis of studies done throughout North America over the last 50 years, has found that the average high school kid in the United States in 1997 is as anxious as the average psychiatric patient in the early 1950s. So what do we know about worry? Worry is it's primarily abstract thinking. People who worry seem to follow a set of rules. You think about what you may worry about. You might worry about relationships. You might worry about passing a test. You might worry about your patients. You might worry about your finances. You might worry about your health. People worry about a lot of different things. I think that people actually have a set of rules that they follow that kind of guides them in their worry and adds to the worry. The first rule is if something bad could happen, if you can simply imagine it, then it's your responsibility to worry about it. That's the first rule. You have a responsibility to worry about your negative thoughts. Second, don't accept any uncertainty. You need to know for sure. People who worry find uncertainty to be intolerable. 3, treat all of your negative thoughts as if they're really true. So if you have the thought that you might have cancer, treat that thought of it as if it's a proven fact. 4th, anything bad that could happen is a reflection of who you are as a person. So if your patient is not getting better, it must be because you're a bad therapist. If your husband or wife is upset, it must be because you're a bad partner. Or if you hold a party and someone's not enjoying themselves, it must be because you're a bad host. 5th, failure is unacceptable. Worriers think that they cannot tolerate failure at all, that failure is catastrophic, and failure is permanent, and that they are a failure if they fail at one thing. 6th, get rid of any negative feeling immediately. Worriers tend to think that negative emotions such as anxiety or sadness or anger or confusion or envy or jealousy, that these are emotions that they cannot tolerate. And we know that worriers have a very negative view of emotion. And keeping in mind that worry is abstract thinking, not emotion. It's not visual images. It's not feeling the emotion. It's trying to think your way through it. So being a worrier is in some ways being an overthinker. And finally, number 7, treat everything like an emergency. So if you think at 3 o'clock in the morning, will I ever find the love of my life, and you don't have the love of your life at 3 o'clock in the morning, you really need to know at that time for sure who the love of your life will be and when you'll find that person. So these 7 rules seem to guide worriers, but there's an 8th rule. There's an 8th rule that I didn't mention, because a lot of times worriers have a positive view of worry, that worry will help me solve problems, it'll prepare me for the worst, it'll get rid of negative emotions. But there's an eighth rule, which is that if I start worrying, I have to stop worrying immediately. So worriers are of a mixed mind. On the one hand, I've got to worry to be prepared, to be responsible, to avoid danger, to solve problems, to be motivated. That's what we call positive views of worry. And then we have the negative view of worry, that worry will drive me crazy, worry will make me sick, worry will ruin my life, and so I have to stop worrying. So it's kind of like I need to worry, but I also need to stop worrying. These are the 7 rules of the highly worried person. And I think if you think about it, maybe you yourself have followed some of these rules. Let me outline just a few things that we found to be very useful in handling worry. The first step is to distinguish between productive and unproductive worry. So for example, I'm going to give a workshop on Saturday. Today is Thursday in New York City. I'm going to give a workshop in 2 days on worry. The question is, am I prepared? So productive worry might be to see if I have my outline of my talk, do I know what I'm talking about, and so forth. I do have an outline of the talk. Have I printed up handouts for my participants in the workshop? That would be productive action. So productive worry leads to productive action today. Unproductive worry, all the things that I can't really do anything about today. So, for example, unproductive worry would be, what if somebody in the workshop doesn't like it? There's nothing I can do about that today. So the first thing to ask myself, is my worry productive? Does it lead to productive action today, or is it unproductive? The second thing is to accept reality and to commit to change at the same time. Accepting reality means I accept limitations, I accept uncertainty, I accept imperfection, and to some extent maybe I need to accept some unfairness. Acceptance doesn't mean I like it, it just simply means I'm realistic about what really exists. And committing to change means I'm willing to do the hard things, the uncomfortable things, to make my life better. The third step is to challenge my worried thinking, and this is where a lot of the traditional cognitive therapy is quite useful. So for example, the fortune telling that I'll make a complete fool of myself, I can look at that fortune telling and ask myself, is there any evidence that that's what usually happens? Am I making predictions based on very little evidence? Or am I mind reading? Or am I personalizing things? Am I taking things too personally? Or am I thinking that a negative event is a catastrophe? So these are ways in which I can use traditional cognitive therapy. One other thing I can do is to set aside worry time. So rather than worry 24 hours a day, I can set aside maybe 20 minutes each day where I focus on my worry and I submit my worry to these tests about whether it's productive or unproductive, whether or not I have any evidence to support my worries, whether or not I'm distorting things. The fourth thing is to focus on the deeper threat. And many of us have particular issues that we worry about. Some people worry about abandonment, some people worry about competence, some people worry about helplessness, some people worry about unfairness, and so forth. So you need to look at your own particular issue. If you're a particularly conscientious person, you'll probably worry that you won't get things done just right. You need to examine whether you have to be perfect in order to be okay, to be good enough. The fifth thing is to turn failure into opportunity. I look at failure as simply evidence that you're involved in the real world. All of us fail at something. You can't go through life doing things unless you're willing to fail. So you need to think about failure as not a catastrophe, but as sort of a process of getting on with things in real life. And sixth is to use your emotions rather than worry about them. In other words, it's legitimate if you're a mother or father to be worried about your child. I mean, how could you be a loving mother or father and never worry about your children? So sometimes having anxiety actually points to your valued needs and your valued aspirations. Worry is, having anxiety or sadness is not in itself a bad thing. It's the degree to which it impairs your life. I view life as comprised of many different emotions, some positive and some painful. And finally, taking control of time. We know that worriers are always thinking about the future. In fact, The research actually shows that 85% of the things that people worry about never happen. So people are worried about a future that never really occurs. Staying in the present moment and focusing on what you can do right now and how you can be aware of things right now, how you can use mindfulness meditation right now, and staying in the moment and doing things that are in the real world, solving problems now rather than worried about 85 problems that never exist in the future. These are some of the ideas that we've been using in the treatment of generalized anxiety disorder. We found this to be very useful, very productive, and there's a lot of research now that supports this sort of complex cognitive behavioral model. I hope I've been able to give you some ideas of how generalized anxiety can be treated with an integrated cognitive behavioral model, and I hope that we can maintain our contact between the International Association of Cognitive Psychotherapy and the Pakistan Association of Cognitive Psychotherapy. And I want to thank you again, Dr. Rashid and your colleagues, for inviting me to participate in this way, the teleconference way, with your conference, and I wish you the very best of luck. Thank you so much.